everyone, and welcome to Take a Pause with Menopause, where, as you know, we talk about everything about the pause in all of her glory and not so glory. Sometimes there's funny things, and sometimes things that even people don't want to talk about. Go without saying the word menopause, but really nobody likes to talk about sexual health, which goes along with menopause. So we figured we will help people feel, like connected with their bodies again and just maybe understand what happens through this stage because it's the first time I'm going through it. So, as we all are. So I figured we can all know that, it's something that happens to all of us and we're not broken. I mean, things may be a little sluggish, if you know what I mean,
They feel
but
a lot broken a lot of the times, but they're
yeah,
not.
but they're not. They are not broken. And we'll figure out what's really happening and what we can do to help other women that are experiencing situations like this. So, my co hosts, as usual, are Deb and Raquel, my menopause partners in crime. And today we are very excited to be, and I'm honored to have Maya from Sweden. Yes, that's
Hello.
right,
Oh
girls.
my
We
God.
go, yes, we go not only in the US, we hit everything. So we're global now. So I figured, Raquel, since you know Maya longer, you can give us an introduction to this lovely woman.
Absolutely, my pleasure. And Maya, thank you so much for joining us. Honestly, like it's really very nice of you. I know it's very late there, and I appreciate you staying up a little bit late to record with us. Maya is a licensed midwife in Sweden, which does navigate intimacy during perimenopause and menopause for the licensing that they currently have in Sweden, but she's in sexual therapy school currently. So I'm going to let her kind of identify what she does because there's a little bit of crossover between what the US has and what, other countries have. And so I think it's really a great thing to hear what other countries are doing and how we're addressing this globally and Maya, well, looking forward to hearing.
Thank you very much, and I'm very honored to be here with you. So I'm a midwife, which in Sweden means 4.5 year at university with a master's degree in sexual and reproductive and perinatal health. So what we work with is the normal phases of any woman's life, and it's actually from the first menstruation to until she dies.
Yeah. Yeah.
Because this is how long you have your sexual and reproductive health in your
Well,
life.
we'd like to think so, anyways.
Yeah, yeah, exactly.
We'd like to not be not sexually active as we get older.
Yeah, yeah, exactly. I mean, so this is what I work with, and we are in Sweden or in Europe in general. I would say Sweden very much. We are very independent practitioners, and as long as it's within the normal range, meaning no pathology, it's on our table.
Okay.
In
Okay.
me, my special interest is really sexuality because I think it is as complex and intriguing and fun and challenging as life is. So sexuality issues and the sexual part of my work is the one that I enjoy the most.
Yeah.
Well,
What are some of the
thank you
conversations?
for
Oh, sorry, baby.
explaining all that to us.
Yeah, it's so
And
different.
Yeah.
yeah, and
Different, but
because
not.
yeah, but the
Mm-hmm.
best part is that you're going to help normalize this conversation, which I'm the first one to say this is not a normal conversation for me. So bear with me. So we're going to start with what changes and why. Um, so we're going to start with the basics because women feel like all of a sudden things are changing and it's confusing. And so let's just start with the most common sexual changes that women experience during perimenopause and menopause. What's the first change we would notice?
I mean, if it's I mean, it's hard to say just sexually what will change because everything changes. So your hormone levels go
Very true.
down.
Yeah.
Yeah, and depending on what kind of symptoms you have, because it might sound a bit provocative, but some women do not have symptoms at all. They just end up with not having menstruation, and then they live happily ever after.
Must
Uh,
be nice.
yeah,
Wow.
exactly.
I want to be
Could
that
be
woman.
that
Exactly. There are not that many, but it exists. They do exist. Um, for most people, what the symptoms that are the most prominent would be dryness, and not only in the vagina, but also like dryness of all your mucous membranes, which means eyes, which means also maybe nose. But a prominent one is the vagina mucosal layers that goes a bit more dry. I mean, that would be the one connected to your sexual life that you might really, but other than that, I mean, the when you enter menopause, the primarily symptom is actually the not really sleeping well and the hot
Yeah.
flashes.
The sleeping was what really got me the most. Like,
Hmm.
if I don't sleep, I'm a raging lunatic. I just like, I'm like,
Yeah, 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 like anyone. I mean, we have different tolerance to not sleeping well, but at the end of, I mean, when you start accumulating that and you're not sleeping well for one day, 3 days, 10 days, 20 days, I mean, it's you accumulate that, and that is it doesn't make you a nice person. You don't like yourself. You don't like anyone else.
right.
yeah.
It's
And I don't
No.
think you can feel sexy. You know, like
no,
it's like the image that you get, like, oh, I'm gonna, you feel sexy, and you're like, I'm exhausted.
exactly,
Yeah, I don't even want
exactly.
to
Leave me
look at
alone. Yeah, I want to go to bed. Don't talk to me.
Just
I'm
do
gonna try
bed.
this sleep thing
Yeah.
one more time.
Yeah, yeah, yeah,
Yeah.
yeah.
I want to hug my pillow, and that is it. Yeah.
Exactly. Yeah.
And hopefully it's warm.
Yeah. Or not too
But I
warm because
also,
you will have your hot flashes.
Oh,
yeah,
true story, true
Yeah.
story.
but I also feel like your desire for
Mm-hmm.
sexuality and your your arousal, as you could tell, this
Mm-hmm.
isn't a subject I'm very comfortable with,
Mm-hmm.
which is a big, I'm going to be 67 next
Mm-hmm.
month. And this is really the first time I've had this conversation.
Okay.
So, which is really sad,
Mm-hmm.
but that's what shows why this is
Mm-hmm.
important, because I feel like when you're going through this, you don't understand why are things changing, as
Yep.
I would say down there. Why are they dry? Why does it hurt? So, why is it, not working? But it doesn't mean that something's wrong with us. But when we first start seeing those changes, how do we cope with that? I mean, how do we deal with it?
Yeah. In I mean, congratulations for actually talking about it, Debbie.
I know, right?
Yes, absolutely.
It has to.
Yeah, and also, as you said, it's a bit sad as well. And I do think that us healthcare professionals, we actually bear quite a lot of burden on that because we are supposed to be the one making it easier for you. And if we're not really doing that, and then we know it's a subject that is quite taboo, sexuality is menopause as well, and then we can't really expect you, our patients, our clients. I don't know what you call them in the US, but I say patients.
Yeah.
We do say thanks.
um, so we need to make it easy for you. And we're not really doing that because sexuality is also, even here, even not where I work, but even in Europe, in Sweden, it's still a bit taboo.
Well, it's
So,
interesting how you said that too, Maya, because you
mm,
said, it's our job to make it easier for you, and like you guys are feeling this like pressure also because we're coming in the masses now, like
mhm.
we are in menopause, we
Yeah,
need help.
yeah,
So I didn't even actually put that perspective together that you as the provider are feeling like pressure as well, and you may need support.
yeah. I mean, I would say most people who are not used to, and even me, when I started working with this, I found it hard to find words. I mean, what do I call it? Do I say vagina? Do I say down there? I mean, I cannot say
Yeah,
down
yeah.
there. What am I mean? I
Debbie will
mean,
always go down there. She
yeah.
will always just say, yeah,
Yeah,
with
yeah,
it
she's really
pointing.
struggling
That's
with
it.
getting some of these words out. The poor thing, she just doesn't talk like this. That's not our wheelhouse.
Yeah, I would say that you represent quite a lot of people actually, Debbie, that are not really comfortable with
Right,
speaking
right.
about.
Especially people I think in Debbie's age group too, because like my mom, for instance, is very much like Debbie, and they're around the same age,
Hmm.
and it's just it's not something that was talked about
Yeah,
then.
yeah. Mhm.
Yeah.
Yeah, it's not just it wasn't talked about. When you went to the doctor and you wanted to say, hey, something's changing down there, you didn't even know how to express it. So when you would say, it's really getting dry, or it's itchy, or I'm uncomfortable, or it hurts, most of the time they'd be like, well, that's just what happens. Well, why does it have to happen? I mean, it's to share with us tools and how we can, get some hormones or something. But I feel like I personally, and I'm sure there's many more women out there who didn't even know how to ask the doctor, didn't even know what to say because never talked about it with your parents. So how are you going to go talk to this doctor when you're like in your 30s or 40s and you're just not understanding what's wrong with you?
And you feel isolated because you don't realize, because nobody's talked about it, like other women are struggling from these same things. So then you feel like you're you're the oddity. You're the one that's like, oh my gosh, something's wrong with you. You know what I mean?
But you also have to explain it to your partner or who you're with. And that's a whole nother, because like I say, you don't, because you don't feel like yourself and you don't know why. But with all of that, can you explain, like, is there a difference between low desire and responsive desire?
Yeah.
That's when things are changing. You don't know, is it me? Is it my hormones? How do you even know if you're going through that, or is it just in your mind? It's really a frustrating topic.
Yeah, there is a difference, and also Debbie, because you actually did ask a question before we sidetracked, and you asked about like how menopause can affect your desire, or you don't really feel like it anymore, and that has a lot of so sexuality, as I said before, is really multifactorial. It's you have a lot of different factors that influence your your sexuality, and it can be your health, it can be your hormones, it can be expectations, it can be your general medical condition, it can be how you sleep, your relationship, and when you go through menopause, a lot of things are happening in your body that you're not really in control of, as life tend to be. I mean, we don't really have that much control as we wish we had. And menopause really it really, what's happening to you is massive normally for most people, not these few ones that don't even notice it, but for most of us it is massive. And so on the one side, hormones will affect you, so your desire changes maybe, but I would honestly say that rather than the hormones, I would put more I would focus more on your well-being.
Oh, I love that. I absolutely love that.
Yeah, and it's like what you said before, like if you're not sleeping well, I mean, if you haven't slept for months, then you don't really feel like, I mean, leave me alone.
Anything. Yeah.
Yeah.
Well, and I think to your point also, Maya, is like it's a lifestyle change. It's not just
Yes.
hormones.
Yeah.
You know what I mean? And that's one of the things that we talk about a lot. Like
Mhm.
even if it's 5 minutes that you work out, I don't care if you walk to the mailbox and back. At least you got yourself moving. And it's little steps like that, right? Or just change one meal out of the day. You don't have to cut all meals to something super healthy, but one meal at
Yeah.
least is a step in the right direction for a lifestyle change.
Yeah, and maybe that's the only thing you can actually ask for yourself, or from yourself when you're not sleeping well, when you're not feeling very good, when everything that is happening to you. And menopause is also normally quite significant in the way that, as you said, like this is life changing, but it also represents, for some people, it's really important to know that I can have children. But you're leaving that behind. That is forever a door that is closing. And
The
for
loss
some people,
almost, you're kind of mourning it.
yeah, for some people it's really mourning. And you need to consider that. For some people it's actually a relief, like I cannot get pregnant anymore. I can, yeah. Exactly. Let me enjoy whatever I want to enjoy without having to worry. So that can be different. But normally it represents something also. It represents that we're not young anymore. And that can also be quite challenging because as women, we're supposed to be young and fresh and beautiful, and our muscles should be, I mean, we should be like we're 20, but that is impossible.
Yes, yes.
So all these things, they affect you, and they affect how you look at yourself and how you relate to if you have a partner, if you don't have it, but it will, this affects you and everything around you. So it is impossible not to get, except it's very few women.
Right? Some of those lucky ones.
Yeah,
We don't
exactly.
even, we're going to call them unicorns because we don't even know who they are.
Yeah,
They're-
exactly. The ones that we heard about, that I read about, but I never met.
Yeah.
Precisely.
Yeah. So your question, Debbie, about responsive desire and lack of desire. So one thing is like, I really don't feel like having any kind of sex, and that sex can be sex with myself. But it can also be, yeah, I saw that face.
I love it. Everybody needs, as I say, and Debbie's going to love this, but every woman needs a bob, which is a battery operated
Debbie is turning
Yeah,
redder
yeah.
by the second. Mine, she's the color
Always.
of your shirt.
She's gonna change her shirt soon. She's gonna bring up the fan. We're gonna see the fan. There it is.
That's good.
Oh,
That's
Okay,
good.
let's go back to Bob.
Yes.
all eyes off of you, Debbie.
No, but Mayor, thank you for bringing that up because I feel like I didn't even know what a bob was for many, many years, and you feel like am I guilty? How do I do this? Am I the only one? Then
Am I
you
being
have
weird
friends.
because of this?
Yeah,
Like
yeah.
there's so many thoughts that go through, yeah.
It's just a really uncomfortable, as you could tell. I'm super uncomfortable with this right now, but I do know it's super important, and I feel like it's important for women to hear that, these changes, they're biological, they're neurological and emotional, but at the time we're thinking that we're failing, and we just need to know we are not failing, and that's why I feel like these conversations are important for
Absolutely.
other women to say to us, you know what, this is normal. It's okay that you feel this way.
Yeah.
And that's why, having you here to let us know that there isn't anything wrong. It's our system is changing. So it's really, it's a
And
big
it's a
deal.
fresh perspective too. I really appreciate your perspective because it's very fresh and it very much aligns with how we think about things. And it's like a lifestyle and it's things that we can't help per se. So it's just managing that.
Yeah,
Right.
because you need to
And
relate
that's
to
what I
this, to these changes.
Mm-hmm.
But you were also mentioning, Debbie, responsive sexual desire or responsive. So what that means is that most people, and it's not because we're in menopause, it's because most people, they respond to sexual, or they respond with sexual arousal when they have a stimuli. And in this case, we're talking about sexuality, so a sexual stimuli, and that could be a thought. It could be like, I really like what I'm seeing, or I wonder if whatever that could be. But it could be a fantasy. It could be a novel that you write, that you're reading, or listening to, or a film, like a really sexy scene on a film. And that might spark something, it might awaken something in you. So that is a responsive, this is what it is. You're responding to something. It could be a kiss, it could be a touch, it could be, or in that kiss and that touch in a context where you actually are welcoming it. Maybe not if you have your grandma next to you.
Your hormones are a little off. You got like a 5-minute window. You're like, I like you now, about 2 minutes from now.
Yeah, so everything has to do with the context as well. So the responsiveness on how you will react and respond to whatever stimuli that you're getting. It depends not only on your thoughts and your well-being or how you feel, but it's very, very attached to the context that you are in. So the same kiss, the same caress, the same, I don't know what could trigger your fantasy. If it's in the wrong context, you will not respond to it because you will break yourself. You have your grandma here, you will not.
Or if you're with the wrong person,
Definitely.
or the wrong situation.
Definitely.
And I think that that's really important because a lot of people are with the wrong people, but they keep trying to make it work, and then you wonder, you feel you're broken. But a lot of times you're just not with like you said, you're not in the right atmosphere, you're not in the right place. It doesn't mean something's wrong with you. It just means maybe this is not the right time or the right person for you to experience that response.
Yeah, exactly. So the responsive and the lack of desire, they get very mixed up because a lot of times is that our buttons are not being pushed. I mean, the right ones are not being pushed. It's a little bit like if I would invite you to my home and I would cook you dinner. So sexuality, when you have sex with another person, is very much about communication. What do you like? How can I make it nice for you? So it's really about that communication. And so if I would be inviting you to my home and cook for you, it's very different if I cook something that I really like. And then I don't really, if you like it, that's fantastic. But if you don't like it, then I don't really mind because I like the meal that I cooked for you to share with you. So that's very different from like actually asking you, okay, what do you like? Do you eat fish? So these are the two different things. So if I will never be pushing the right buttons, then maybe you're not really responding to it. Maybe it's not lack of desire. Maybe it's just that you're not doing it for me. You're not my cup of tea. We're not matching here. So it's really a lack of communication a lot of times. And
when kind of talking to that point, like why is intimacy so difficult to communicate about when like you have a long-term like sexual partner? You know what I mean? Because I feel like there's this like intersect where it becomes like, oh my gosh, this is super fun, blah, blah, blah. And then, time goes on and then it's like, how do you even talk about it anymore?
Yeah.
Right? Like you don't, it's like you've been with this person for so long, but how do you discuss that? You know that person's sexual desires or wants or whatever, but it just becomes like harder to discuss, in my opinion.
But I think they change as well throughout the years.
Yeah, I do too.
Yeah.
I do too.
And I think women, I know myself, like about like exactly what you were saying. I never knew that there was a difference between responsive desire and low desire because, I feel like, oh, I'm just so tired. And, you go from being like a sexual being that you're like, oh yeah, let's like, oh yeah, it's Friday night. Like, and then you go to like, oh wow, it's been 3 Friday nights and I have, and I'm okay with that. And then
don't
it's
talk
going
to
to
me
another.
still.
yeah.
And then, but you like go and you see something or you read a book or something and you get that like, ooh, Zao. You're like, okay, well, where was that on Friday night?
Yeah.
Do you know what I mean? Because I'm like, but it gives you hope that like, hey, wait a minute, if I got, hello, I still, yeah, but I wish I had it Friday. But it is the context of what you say. If you just got done working 10 hours and you're a little pudgier than you used to be because you're feeling
That
bloated.
I think is a big deal.
Yeah, you're not going to feel, everybody feels their best when they feel like, I don't know, like they're happy with their own body image. And when one thing starts clicking away, like, oh, my hair's getting thinner, like I said in this, your hair is thinner. Oh, I'm a little pudgy. Like, now try to find a sexy little pajama to make you feel like, hey.
Or try to hide that extra wrinkle that you just found that morning. You know what I mean?
Yes.
So it is all the context. It is exactly, that is
It's like when you have something hanging out of your teeth, like you're just standing there and you're just like, please don't notice that wrinkle because that's all you hyper focus on, like the damn wrinkle. But meanwhile, like they're like, hey,
if you asked, if you asked and you like, if I asked my husband, like he would be like, what wrinkle? Like, you're saying, I don't even, but I'm like, this one here, look at the neck. And he was like, I don't see it. And I'm like, no, the neck. Are you looking? And he was like, no, I'm not.
Get a little closer.
So
see it.
Yeah.
So
I asked Becky this morning, I'm like, hey, I'm trying this new face cream. Do you like it? And she's like, Uh-huh. It's been a day.
You only put it on one day.
That's
Come on
exactly
now.
it. It's been a day.
It's
She's like,
been a day. It's like, has it worked? I'm like, I don't know.
Yeah.
I never
But
paid
it
attention to it before
I know.
you.
I know.
But I
We've
think
been friends for years.
you
but
become
most
hyper focused on everything. You
Correct.
just
but
hyper
women are.
fixate on everything.
But we are. It's so true because we look at ourselves and we're so critical, and I'm
Critical.
super critical. But
Same.
usually, your partner is looking at you and seeing your heart. They're seeing your soul. They're not even
Right.
paying attention.
But we
But
lose
it's
track of that.
but we do. But they will say to you, "I think you're beautiful. I love you just the way you are." And we're like, "Oh, I don't know. I gotta fix all this." But I feel like these conversations, this is why it's so important, so you can help guide us through all of that and just help us get through it. And Mary, I know you had some questions as well
Yeah, like,
on this whole time.
well, too, with the libido change, like that you said, like we
Yeah.
already know that there are unicorns out there, and God love them.
God
That
love
they
them.
are not
Keep your
experiencing
hands down,
things,
Yes.
but anything.
You look into your cardiovascular and all of your good things inside because, even though on the outside you may be feeling great, you want to make sure internally you're good.
Yeah, but it's like how it's different on every woman because women like to talk, sort of, but there is like a boundary where you're not going to say like, oh hey, how long has it been since you had
Right.
yeah. But they're so different, like you said. Like, so is it just every woman's different because of her own hormones that are going up and down all at the same time?
I mean, yes, hormones they do influence, but I would really rather focus because speaking of hormones, it's important, it's a factor, but I do think it's misleading if we start talking about, oh, okay, but you will not feel desire, you will not feel or you will not orgasm because of your hormones. It might be one of the factors, but it's my experience, it's really not the primary factor. It's about not talking about it, and I mean a conversation if you have a partner with your partner, but mainly with yourself. That because what happens is that you will go through changes, and normally when we go through changes, when it works, is actually when we adapt to the changes. So either you take hormone therapy, which is a really good, it's a really good treatment. It's very effective. So I would really recommend that, but I leave that to the medical doctor to to talk about that. But then you also might have to actually work on your view on the relationship that you have with your sexuality and how does that feel.
Right.
In one way is really to challenge yourself, just like Debbie, you are doing right now. That you're actually here. You're actually asking things. You're actually thinking about these things, and this is how we grow. No one grows with doing the same thing forever and ever,
I
never
agree.
thinking new thoughts, and never. We grow as human beings when we challenge ourselves, and this is the
Yes.
challenge, because in
This is
you,
the challenge.
yeah, it really is, and you have to. There is no other
Challenge.
way. It is. I mean, it can really be. And if we don't adapt, so maybe when it comes to sexuality, maybe you need to have a conversation with yourself, like, okay, so if intercourse is not really feeling that great anymore, what can I do? Or is there anything else that is sexual for me, or is it has my sexuality only been intercourse, and there is no other sexuality, there's no other way of pleasure for me than intercourse? So I would really like to invite you to ask that. To is there anything else that I like? Is there anything, whatever that might be? I used to have a patient that once said he was a he and he had cancer, and he lost the ability to have an erection. So he could not have sex as he used to be, and he only had with his wife like intercourse. This is the way they had sex. And I met them as a couple. And I remember like one of the last times that we met that he said that this journey had been really challenging for him. It was horrible in many ways, but that he and his wife actually ended up having a much better sex life because he described it as before my pleasure was on my penis. This is
Yep.
everything that was sex to me and pleasure. But now I have a repertoire of like at least 20 different things.
Yep.
And he really
Oh,
reflected on
that's
it.
wonderful.
It was because he really reflected like this tragedy for me really pushed me and my wife to have to talk about this and to kind of reinvent and or maybe not reinvent but rediscover what they had when they were
Yeah.
young, when they wanted to play, when they wanted to discover each other, when they were like, okay, how does this feel? How does that feel? No, no, I don't like that. Oh, but this. What if we? And they did that together. But it was really a conversation with themselves as well, the wife and also him, that they had to have that conversation with themselves, and then they were really brave and they had it together.
Do you have
So,
any like tips or talk
mhm,
topics that people could talk about? You know, it's I
mhm,
think
Like
it's
how to bring
for
up the
women.
conversation to
Yeah,
your
women
partner.
are
Right.
really have a difficult time with that, especially in long-term relationships because you know you had
yeah,
like your gentleman here, like he had had a long-time partner and they had comfort in how they had sex and now they're you know things are different and so how does that like how are some of those conversations explained or how do you know do you have any tips or tricks for some of us out there?
yeah. I would maybe start with like pointing out some changes in your body or in your mood, like how things. Oh, you know what? Now I'm starting to feel. Um, I don't know. Maybe I'm feeling more dry. I'm not lubricating as much as before. It
Yeah.
feels different
Hmm.
because that is kind of it takes away a little bit the pressure of the norms, the expectations, but rather talk about
Yes.
something quite factual that you can kind of explain from a medical point of view that it's not you that it's nothing wrong with you. This is something due to hormones, and that can normally take off a bit of the pressure. That, like you said, all of you have actually mentioned like that you feel broken, that you feel something wrong with me. So that
Yes.
could be. I would maybe start with that something that can be quite not really challenged from a
Okay.
med and then
Hmm.
start talking about it, like inviting into that conversation that okay, yeah. And I think it's really good to say if it's a hard conversation, normally it's a good thing to say that this is really challenging for me. I'm feeling uncomfortable. I don't really know what to say, and can we do this together? Can we help each other here?
Uh-huh. Uh-huh. I do like that. I really do. What are some ways that partners can show up supportively instead of talking, just taking these changes personally? Like, are there ways that we can um, start to kind of like lay that landscape so it doesn't feel personal? Because I
Mhm.
think for men and women, we start to take it personal. Like, oh, they don't find me attractive.
Yeah,
Oh, they, you know, oh, they saw the wrinkle. They
yeah,
thought,
Yeah.
"Shit, I'm out to
Yeah.
pasture.
exactly. Yeah,
Uh-huh.
mm,
Yeah. Yeah.
yeah.
Or the out to pasture thing. You know what I mean? Like you
Oh
feel like how
yeah.
society views it. You know,
Mhm.
if you look at, like nobody in Hollywood admits that they're in menopause. We know the women that are in menopause,
No.
right? And I'm like, okay, but their age and you do girl math, carry the one, yet definitely menopause, yet they don't talk about it, and so you feel like, gosh, well, this is me at the same age, and look at them in Hollywood, and you make that comparison, and I'm sure that like partners do the same thing too, like,
Mhm.
well, she wanted to last Friday, but now is it
What's
me?
wrong with
And
her?
what's
Mhm.
wrong? Yeah,
Uh-huh.
and
Yeah, and then they do start questioning themselves, I think. They're like, "Oh
yeah,
great, it's me. There's something. Oh, the
Because
relationship's over." Mhm.
because it's not always just wrong. The men
Mhm.
or whoever partner is saying, "What's wrong with me? How come you don't
yeah,
find me attractive?
Yeah.
How come
right,
it's not working?" But in our mind, we're like, "I don't know what's happening," and they're like, "Well,
Yeah.
what's the problem?" And you're like, "I don't know." But
Uh-huh.
nobody said the word menopause. Nobody talked about how
yeah,
your body was changing,
Mhm.
and that's what's good about this conversation is that all those years, I didn't even know what menopause was. It
Mhm.
was a change. I don't
Mhm.
know. But until recently, I'm like, oh, that's was half of my problem. But at the same time, you're feeling like you're not performing, like something's not right, and they're blaming you.
Yep.
And then, so you're in this endless cycle of what's
Mhm.
yeah,
wrong with you? How come you
yeah,
don't do this? You're like, I don't know. Like, help me. But
Mhm.
I feel like if we could have said, I really don't know what's wrong, can
yeah,
we talk about this? Can we go to somebody and talk together? And then if somebody were to say to you, you know what, or say to him, if this is, this is a thing we're going through, like, let's work together, a lot of relationships would be saved because they actually had that conversation. And that's
Yeah.
why we're here now. We're trying to open that conversation, and it will save a lot of marriages, because
Yeah.
there's a lot of women who just, I hear, who say, I'm done.
Yeah.
I don't have anything. And the men are like, okay, she's done.
Mm.
Like, what am I going to do now? Like, how's that going to help me? And that happens a lot. I'm just being honest with you.
No, it's true. I mean, I think it's like this guy that she was talking about. Like his definition of like pleasure with sex was just the end game, but there he's learned through his changing of his body, like all the different ways that you can have intimacy.
Yep. And intimacy
And I
is
think
really
it's
key. Yeah, sorry.
I was going to say sometimes too. I think for women and all that, you do want the romance. So when you're younger, you maybe didn't need as much romance. You loved it, but you were like, hey, this is good. Everything is well.
Wham
But then
bam.
as you get older, like even just in your like 30s and 40s, like I noticed with myself, like you get more caught up. Like you have to start thinking about it. You start thinking about it in the afternoon, and then that gets like everything,
You
like
gotta
you
like
said,
give yourself
like,
free game time.
yeah, but like you want like the dinner and the conversation and the like all of that, and then that sort of sets you up. So you do want the whole picture. You want, like he said, he had like a whole repertoire of stuff. Like you want the whole picture and not just the end game. And I think that sometimes women don't know how to. I mean, I didn't know how to say it, but
Right, and I think when you feel connected too, if you do sit down
to
and have
connect
just
it, yeah.
dinner and a conversation, and it doesn't have to be a sexual conversation. It can just be like, "How was your day?" And if you genuinely feel like you're connected with that person and they're listening and you feel seen and validated, I think that changes the landscape.
It does, and we also know that feeling safe in a safe environment where you feel that this person wants good for me. So whatever, if even if I say something that that person might not understand, that the intention is good, you feel safe, you feel like you can actually be vulnerable. This is magic for your not only your relationship but obviously your sexuality, and that also goes with for yourself. Like you were mentioning before, Debbie, that we can be so critical towards ourselves, that we're not enough, that we're broken, or whatever that something is wrong with me. So that kind of uh, safe environment, we need to actually apply that and have that with ourselves. And it
Right.
sounds a bit boring, but it's actually it's kind of like the golden key for your sexuality.
Well, it also calms down your central nervous system too when you feel safe. When you feel like you're in a safe space, in a safe environment, because like your central nervous system is so pre-wired by your brain, and it's like it's constant thought processes of like thinking to the future and thinking behind. And, how many I don't know how many conversations I've woken up at 3 in the morning and thought about, like, oh, when I was 8, I had this conversation. Like, who even cares at 8 years? You know what I mean? Or 20 or 30.
Yeah.
But you do. Like, your brain just like wakes up and thinks about the most ridiculous stuff. But I think just settling your brain and its processes down and saying, hey, you're here, you're safe, and like now let's just do what this is so
Yeah.
really important. And I didn't realize that until I got to menopause or perimenopause. I mean, it just became such a like pillar of my healing journey, I think, through this, or like learning journey through perimenopause, is like letting myself know I'm safe all the time, regardless of whatever that situation is, because you just constantly feel like this unsafety because you're not yourself. You don't even know who the heck you are anymore in your own skin.
Yeah, and if your partner doesn't because you were asking before, like what can we do? How can our
Yeah.
partners help us? Or I would say that make sure that they get informed, that they understand what it is and how it affects you or us. But also not only like factual, but also reflecting on it. what would happen to me if I could no longer sleep for all this time, or what would happen to me if I would be in the situation? Because just information and no process of the information where you actually have to apply it to real life situations doesn't really make that much of a difference. So it's really about actually reflecting on it and trying to understand each other, because that actually goes a long way to just to listen to each other and to validate each other.
I think it makes a huge difference. Yeah.
It does, because then you each know, like, he's not judging, or
Mm,
she, whoever your partner is, they're not judging you.
mm,
And you're not judging them because you think, oh, do they think I gained weight now? They don't find me sexy. They don't
yeah,
even
Yeah.
think that.
yeah,
They weren't even, but it's just that negative self
yeah,
talk that women
Yes.
do, that obviously it's my fault. Like,
yeah.
you know what I mean? So if you give that up
Mm,
and just be kind to yourself
mm,
and have the conversation, I think that really is key.
I agree with you, Mayor. And I like how you said that too. Like, just be kind to yourself.
mm,
It's-
Yeah,
we forget that so much going through this. I mean,
do.
especially like I think especially if you're not informed and you start going through this transition and you're like really in this weird space and things are just not right, you don't feel right, you think things are just falling apart, and it really just spins you out. Like you just start to like go down these massive like spirals of doom and gloom and
mm,
things are horrible. So I think just having these early conversations and knowing like what you're entering is so key. So
mm.
key.
Yeah.
So maybe you can give us two takeaways from this
Mm,
conversation, Raquel, for us to think about before we go on
Oh,
to our
yeah.
next topic.
mm,
Yeah.
Because there are some takeaways that we should be asking
mm,
and our partners should be asking. I'm going to let you get those out, so they're super important.
mm. Um, I would say work on intimacy, and that could be and really remove the pressure of sex. Uh, so
Yeah.
intimacy in the way that maybe it's enough to just be naked together for 10 minutes each day,
Very
or every
sexy.
Friday, or every Friday. I mean, whatever you,
Yeah.
whatever
Yeah.
works for you, whatever feels okay.
Terry
No,
knows
Yeah.
what.
no, because no, I feel like the pressure is
Mm.
if you're in that state, you feel like you gotta finish it.
Yeah,
And that's
exactly. So I would like
takes
to
the
remove
pressure
that.
of what,
Yes.
yeah,
Abs-
we need to take off
Yeah,
that pressure and
I
realize
really
there's
would like
no,
to remove that and work on intimacy. And really whatever that means, intimacy for you, whatever that is, but work on intimacy. uh,
Nice.
I had a patient that told me that what they do, what is really important for her, is that every day they lay naked in bed, just holding each other. They don't do anything. They just hold each other for 10 minutes and then they get up and then the day starts. But this is something that really unites them. Uh, and that kind
you
of
know,
very seldom leads to sex, but this is something really important for them.
Yeah.
Sorry, you were saying something, Mary.
that is no, I mean, that's just like such a great, like, aha
Mm-hmm.
thing, right?
Right.
Because I think, myself included, you put intimacy and sex, they go right on top of each other. Like, they are intertwined. You can't have one without the other, right? If you're intimate, you must be sexual and with each other.
Mm-hmm.
But if you separate them, I think that has you feeling good about yourself, feeling good about your partner, feeling connected, and then everything else will hopefully follow. Do you know what I mean? But you're intimate, and just being right next to each other, like in bed, naked, like, who else are you going to do that with? You know what I mean? So you do that with your partner, and you're like, oh, I feel really closer to them, and then you start a different day. Like, I never ever separated intimacy and sex. I love Debbie. Fan yourself. Debbie, fan yourself.
I know.
Drink my water.
I'm just watching her in the corner, and she's like,
no, but see, but that's it's because I've never had that opportunity
Yeah.
for that conversation. It always meant it was hand in hand, and if it wasn't
Right.
hand in hand, you were, something was wrong with you.
Yeah.
Like
Right.
you're not being a full woman. You're not,
Yeah.
or the man's thinking, what's wrong with me? So this is
That is
super.
that is a great takeaway.
It,
I
It
it's
love
really
that.
is. It
um,
really is.
But it would be nice for your partner, whichever one's struggling with it, to say, how can I support you? At the end of
Yeah.
the day, it really is saying, how can I support you? How can I support you? How do we work through this together?
Yeah.
And so that's my takeaway, is that how can we support each other? And if it means snuggling, whatever it means, or just having the conversation. And maybe the older we get, the more we understand that.
Yeah.
So I really appreciate you giving us another option. It's pretty important. But so I'm going to go with like the pain, discomfort, discomfort. And there's lots of, like,
We have you
medical
flustered now.
myths that this is, so you could tell I'm really uncomfortable, but that's being real. Because there's a lot of, I'm just going to be calm and real about this. I think a lot of women, you do have the dryness and the pain, and we just endure it. We endure it silently, and we don't want to even say, "Hey, this hurts. What can I
Yeah.
do?" And I feel like a lot of times you go to the doctor and you say, "Why is this so painful? What's happening?" And if you've had a hysterectomy, if you've had anything like that, like I had, it totally changes so much is going on mentally in your body. And when you go to the doctor and you say, I don't understand why does this hurt, and the men or the partner is saying, well, what's wrong with you? Like, why does it hurt? It shouldn't hurt. And then mentally you're like, okay, there's a problem. Like, what is wrong with me? So it would be, how do you know what's common? How do you not, like, is it me? Is it not? And when do we ask for help? At what point does it get where you say, okay, to your doctor, like, this is a problem. You need to help me get through this. At what point do we know that is when we need to say, and where they're not just telling us, oh, it's just, you're just getting old. I'm like, well, no, I don't want to get old with that. Like, so, how do we have that conversation? And when do we know the right time is to have that conversation? With our doctor, with our partner, to be honest.
I would say if it's something that is bothering you, I would really encourage you to have that conversation with your partner, with yourself, with your medical doctor, your midwife, whatever. If it's bothering you, I really do think you should have it. Because there is no clear cut on, okay, if it's hurtful for 3 times, 2 times is okay, but 3 times or more is not okay. I don't. I would never say that I mean, I couldn't really say that, but I do think that if it's bothering you, if this is something that it's unwelcome, it's something that is challenging you, you don't really know how to face it, then ask for help.
So with all of that said, I just want to sit with this for a moment, because there's so many women who just accept it. So I want you, like, to pause here and just let it sink in. Painful sex may be common, but it's never something that should be accepted. And I feel like so many women are like, just do it.
Yeah.
Right. Right.
Just do it. And I think we need to sit back and say, this is our time to say, this is not cool.
Right. It cheapens the intimacy because you're not getting anything from it,
Yep.
and then
Right.
they're just kind of like, this is a job, but he, she, whatever is thinking like, well, you need to perform, and you are thinking, well, I have to perform because that's what I was told to do, and so I can very much see that being something that women experience, and in silence, like Debbie said, a lot of
Right.
silence,
Yeah.
and it sucks because nobody wants to feel like that. Like, you don't want to feel forced to perform in the bedroom.
Yeah. No.
No.
In
But
most
I think it
partners.
also going back to exactly the beginning of what you said, Maya. I'm sorry to cut you off, and because I'm getting all these aha moments over here over in the East Coast here. But that if you have painful sex, right, your responsive desire, I would think, you remember it. So that's not going to be ignited. So you then have the low desire with your responsive
Yeah.
because you remember, oh my God, it was so painful last time.
Yeah.
What if it's painful this time? So then those two don't, you don't get either response. You get
So,
low desire, but with your also responsive desire going down too.
Mm.
Where
but
if you,
no,
sorry,
no, I mean, I'm saying no, that's what makes sense now is we were talking about redefining intimacy.
Mhm.
yeah,
So this all
yes,
really is
yes.
going together. So Mary, you just brought that up and I know that you have questions about that.
No, I just think intimacy, I just never, literally, it was always, I always thought, oh, you're intimate. Yeah, obviously,
Mm.
you're having sex, you're
Right,
intimate.
right,
But
right.
when you separate it and make it its own, its own
Category.
pillar, yes, being intimate with your partners, we all should feel that intimate closeness with them. And that's, I think, what it should be our, not focus, but our main, like, thing to pull back on, in the fact, like, okay, I may not feel as sexual, but I still am as intimate as we always were, or I am working on getting more. So that's how then, I think women should focus on the fact you don't have this, but you have this,
Mm.
and eventually you'll get the sex back.
If you want
Right.
to, I mean,
Good move.
some
Good
people,
move.
I like how she said if you want to, because some people don't want to.
yeah, yeah,
They're happy
Right.
with the
Yeah.
status quo.
yeah,
And that's
definitely.
okay too.
Yeah, absolutely. That's fine as well. As long as, I mean, it has to resonate within you that this is okay.
Yeah.
I want this. It's not because I should, but it's because it feels right for me. Um,
Right. It should be a choice, a decision.
yeah, and I
Um,
mean, from my experience, partners, because you're talking about having sex that is painful, and when you ask partners, a lot of times they obviously they don't want to hurt their partner. They don't want them to. I mean, it's actually a lot of times also seen as a failure from the partner's perspective. Like I was not aware of why haven't you told me? Like all this time and you never told me. How could you not tell me? I never
I
wanted
feel like
to.
it's true.
Yeah,
Because you feel broken. You feel
exactly.
broken.
And
And
you
you're like,
should.
what is wrong
Yeah,
with me?
and you
That's
should.
why I love this
Exactly.
conversation because you are giving us permission to say, this is how I'm feeling.
Yeah,
How
Yeah,
can we work through this
absolutely.
together?
absolutely.
It's a really important conversation and whoever you can have it with, either like your therapist or doctor, you should be able to have it with your partner first.
Yeah, I
And
mean, I would
that's
really
the
suggest
hardest.
you to start small. Start with someone that you feel that you can say things to that won't maybe will laugh with you and maybe a little bit at you because it's funny that you're challenging yourself, but in a in a loving way that
Yeah.
let's laugh about this, let's challenge each other, and thank you for bringing this up with me. I know it's hard. So I would really challenge you to do that with people that you feel that you can trust. And it can be small things. It can be just to say the word vulva or clitoris or I mean just instead of down there. Yeah.
She can't. Vagina. That's her.
I
Maya.
say,
Vagina. Down there.
So I mean whatever the small steps that you take, but challenge it.
Yeah.
Because it would be
They
very
become
hard.
bigger.
Huh?
Yeah. The small steps become bigger. You know what I mean? Like every time you take that one little m- micro step, like it becomes larger and larger. It's like the snowball effect. You know, you start the snowball small and you start rolling it down the hill, and before you know it, you have Frosty the Snowman.
That's
no, but
awesome.
I
And you
kind of
don't
lost
want the carrot that's his nose anymore. The
You're
painful
gonna have to
carrot.
explain that later to me. The whole snowman effect. I don't know.
Oh, shoot. Well, I think we're kind of close to the end, and so we usually do a round of rapid fire questions. So are you okay with that, Maya?
Yep.
We're gonna give you some questions
Okay.
while
So
we're
I
telling.
have just a few like quick ones. So like I'll say it and then you say it quickly. Give me one myth about sex and menopause you want to bust.
That your sexual life ends with menopause.
Oh, that's good. One thing every woman should know.
Herself.
Oh,
Wait,
even better. I love
can
you.
you
That
say that
is
one? I
awesome.
didn't hear that one.
Yep.
Can
I
you say
Said
that?
Herself.
Love herself?
Correct.
Yeah.
Okay.
Yes.
Oh, I get it. Okay, go ahead.
I love you.
My, Debbie is going to have a glass of wine after this.
Yeah.
Well, one thing you wish your partners understood.
Mm, again, themselves, I would say.
Okay.
Also, responsive desire, because they probably have it as well.
Yeah,
It's
yeah.
probably their own way of responding to sexual.
I, God, if this conversation brought something up for you, questions, emotions, grief, that's okay. Seeking help is not a weakness, ladies. It's information. This is how you
Yeah.
grow. Just like Maya had said earlier, like this is our growth period. These are our good old days. So let's make the best of them.
Absolutely.
Intimate,
and
sexually, however we can.
exactly. Exactly. I mean, I learned so much. I hope that, other women that will listen to this will understand, the difference between intimacy and sexuality and, low desire and responsive. I think for me, that's my takeaway.
Yeah, yeah.
And
That's actually those were really good tips because those are things that
Yeah.
you don't think about. You just think about the wrinkle or why he doesn't want to do this or why don't
Right.
I want to. Yeah, yeah.
And it doesn't really have anything to do with sex. It's
No.
just,
Correct.
yes,
So
yes.
wild.
So here is my takeaway.
Mhm.
Intimacy isn't performance. It's safety, it's curiosity, and it's connection.
Mhm.
That would be my takeaway, and it's okay to not be comfortable. It's okay to ask questions and surround yourself with people who you can trust and be open and honest. I wish it didn't take me till almost 67 to be able to talk about it. So please,
glad
out
you're
there
here.
listening,
Yeah,
it's super,
I'm so
no, it's
happy that
super
you're here.
important. You out there listening, I know there's a few of you who are my age or younger who are feeling the same anxiety about this. And the sooner that we become comfortable, the sooner that we will find our own sexuality.
Yeah.
Yeah. Yes. Maya, I can't thank you enough. I can tell you, I think that we really do have to schedule another one in Sweden and globally. We'll go global again, because I think this is just so many. I learned so much from
I
this.
did.
Just
I
and,
did. I walked
and
in thinking I knew a lot. And you do. But then you have a different perspective and you're like, oh my gosh, yes.
which I love, which is really a fresh thing to, we put everything at menopause. You do everything like you put yourself last, right? So if you continue to do that, it's going to show up everywhere. So intimacy and just, as you said, one thing that you want women to know: herself. Make yourself first.
Learn yourself, ladies. Learn who you are.
Yep.
It
Yep.
makes a difference. It makes a difference.
It
It
does.
does.
It's hard.
Thank you. I know. But you got to do it because who doesn't want to be happy? Like
Yeah.
everybody wants to be happy.
Mhm.
Do you have any last words or anything that you would like to end with, Maya?
That you're being very brave, that you're, all of you, especially you, Debbie, that you're being very, very brave, not only because today's topic, but because you're doing something that we are culturally supposed to keep quiet about. And you're not, you're challenging that. So you should be really proud of yourself. And I'm sure that you're making really important work, but just bringing up the topic.
Thank you.
Thank you.
Thank you for
Thank
having
you.
me.
Oh my gosh, thank you
We'll
so
have you
much,
back.
Maya. Yes, we will definitely
It'll be a
have you
pleasure.
back. We learned so much. And as we always like to end the podcast, we will see you next Tuesday.
Perfect.
See ya.